Okay, let's jump right into it. You've given us a really interesting source to unpack today. It's a brand new study, and it gets really specific about long COVID, but in the absolute youngest children.
Exactly. We know long COVID can hit anyone who's had the virus, right? But how it looks, how it presents, that seems to change depending on who you are, especially age.
Yeah, for sure.
So this deep dive, we're focusing on findings from a study just out in JAMA Pediatrics. It's actually a big collaboration. You've got researchers from Mass General Brigham working with the big NIH-funded Recover initiative.
Recover. Okay, yeah.
And our mission today really is to pull out the key insights from this paper. What are these specific, distinct patterns of symptoms they found in infants, toddlers, and preschoolers? And, why does understanding these patterns actually matter?
Right, because Recover has done work before looking at school-age kids, teenagers, which is super valuable stuff. But this under 5 group, they're a completely different ballgame. Developmentally, how they show they're sick, getting data specifically on them feels incredibly important.
It really, really does. And this study, it took a pretty significant step. They managed to include a large group. We're talking 472 infants and toddlers, so under 2 years old.
Wow, okay.
And 539 preschool-aged children, so that's your 3 to 5-year-olds.
Over 1,000 young kids in total. That's actually a solid sample size for this age group, isn't it?
It is, yeah. And they enrolled them over a couple of years, started back in March 2022, right through July 2024. And importantly, they drew participants from loads of different places, over 30 healthcare and community sites across the U.S.
So good geographic spread, too.
Which helps. And crucially, the way they set it up, it wasn't just looking at kids who'd had COVID. They included children with, a documented prior infection. But, and this is key, they also had a comparison group, kids who hadn't had COVID.
Right, the control group. Because you need that baseline, don't you?
Exactly. You have to see if a symptom is genuinely more common after COVID compared to other kids the same age. Otherwise, how do you link it specifically to long COVID?
Makes sense. Okay, so how do they actually get the symptom info? I mean, asking a 1-year-old how they're feeling is, impossible.
Yeah, definitely tricky. So the data relied on caregiver reports. Parents, guardians filling out detailed surveys about their child's health, and the researchers were looking very specifically for symptoms that stuck around, lasting at least 90 days after the initial COVID infection.
90 days. Heck.
Yeah, 3 months. And they had these extensive symptom lists, 41 different symptoms they tracked for the babies and toddlers.
41.
And get this, 75 symptoms for the preschoolers.
Wow, 75. They were thorough.
Very thorough. The analysis then basically compared how often these symptoms were reported in the kids who'd had COVID versus the kids who hadn't, the control group. That's how they pinpointed the symptoms most likely linked to long COVID.
Okay, that sounds like a pretty rigorous approach. That comprehensive list plus the control group seems like a good way to try and isolate what's really going on post-infection. So after all that data crunching, what did they find? What were these distinguishable patterns they talked about?
Right. This is the core finding. And it really backs up this idea that long COVID isn't, one size fits all. It looks different across ages. They found clear patterns specific to these very young groups and different from what you typically hear about in older kids or adults.
Okay, let's break that down by age then. For the really little ones, the infants and toddlers under 2, what symptoms stood out for them?
For that group, the symptoms that were most strongly associated with having had COVID, previously the long COVID symptoms, were things like trouble sleeping, fussiness, poor appetite, a stuffy nose that just wouldn't quit, and a persistent cough.
Trouble sleeping and fussiness in a baby. Goodness. That sounds incredibly tough. And, like you said, potentially hard to tell apart from just normal baby stuff sometimes.
Yeah.
Which makes that control group comparison so critical, yeah.
Absolutely. That comparison is everything there. And then for the slightly older kids, the preschoolers, so aged 3 to 5.
Yeah, what about them?
Their pattern, it shifted a bit. The most likely symptoms in that group, a dry cough, so still a cough, but described differently and feeling unusually tired during the day. Daytime fatigue.
Interesting. So a cough in both, but maybe a different type of cough. And then fatigue really emerges as a key thing for the preschoolers.
Exactly.
It's just fascinating how even within this young age band, the persistent symptoms show up differently. Did they manage to quantify that? Like, how many kids in the study actually showed these patterns?
Yeah, they did. Based on their criteria, their definition for what counted as likely long COVID from the survey data, they found that 14%, so 14% of the infants and toddlers who'd been infected seemed to fit the bill.
14%.
Which worked out to 40 kids out of the 278 infected ones in that age group they studied. And for the preschoolers, it was actually a very similar number, 15%.
15%. Okay.
Which was 61 kids out of the 399 infected ones in that group.
So roughly, 1 in 7 kids in this study population across both these young age groups showed this persistent symptom pattern linked back to having had COVID. That's, well, it's not everybody, but it's definitely a significant minority. The authors must have commented on why pinning down these specific patterns is so important, especially in these little kids.
Oh, absolutely. And this is where you really see the impact, right? One of the co-first authors, they pointed out that the children who had these specific long COVID symptoms, they often had, and this is a quote, worse overall health, lower quality of life, and delays in development.
Oh, wow. Delays in development, that connection is, that's critical.
It is. Connecting symptoms like sleep problems, fussiness, fatigue, whatever it was for their age group, to actual tangible impacts on a young child's health and their developmental path. It's not just them feeling a bit off for a while.
That link to developmental delays really hits home, doesn't it? Early childhood is just such a crucial window for growth and learning. Knowing that specific symptoms after a virus might actually interfere with that whole trajectory.
Yeah,
that feels like a major call to attention.
it really does kind of raise the stakes. And another author, a co-senior author, they highlighted the practical side, too, from a research angle. They noted that the tools they developed, the symptom patterns they identified here, they basically provide a foundation. They can be used in future studies to, hopefully refine our understanding and eventually figure out better ways to care for these very young kids dealing with long COVID.
Right. Having those specific markers, those patterns, that's sort of the first step towards figuring out targeted help, if and when that becomes possible.
Yeah.
But what about the caveats, the limitations? Every study has them, especially one like this. What did the authors flag?
They were definitely careful to include those. A really key one is stressing that the symptoms they identified, they were defined for research purposes within this study. They're not a checklist for making a formal clinical diagnosis in a doctor's office. That's really important.
Yeah, good distinction.
If you, as a parent or caregiver, are worried about your child's symptoms, the advice is crystal clear. Go talk to a clinician. Don't try and self-diagnose using this research pattern.
Right. That difference between a research finding and a clinical tool is super important for listeners to get.
Absolutely. They also pointed out that relying on caregiver reports through surveys, well, it opens the door to recall bias.
Sure. Remembering exactly when something started or stopped months ago.
Yeah, it's tough for anyone. And especially tough, as you pointed out earlier, when the subject is a baby or toddler who can't actually tell you what's wrong or how they feel.
Exactly.
So reporting symptoms accurately is just inherently difficult for kids who are pre-verbal or maybe just starting to talk. And they also mentioned that while they tried to use antibody tests to confirm who'd had COVID, that data might have been incomplete for some kids. Another potential, wrinkle to consider.
Okay, so this study gives us some really valuable specific insights into how long COVID looks in the youngest kids, but it's built on methods that just come with challenges when you're studying this age group.
Precisely. It's a really significant piece of the puzzle, identifying this unique face of long COVID in infants and preschoolers. But it also shines a light on the fact that there's still more work needed in this area. It's complex.
Okay, let's wrap this up then. We've taken a deep dive into this new study from JAMA Pediatrics and the Recover Initiative, and it really reveals that long COVID in our youngest kids, infants, toddlers, preschoolers, it seems to have its own distinct age-specific look. It's not just a mini version of adult long COVID. It shows up as things like, trouble sleeping, fussiness, maybe poor appetite in the really little ones, or specific coughs and daytime tiredness in preschoolers.
Yeah, it really brings those specific impacts into focus for this very vulnerable group.
And crucially, the study found these persistent symptoms weren't just annoying. They were actually associated with worse overall health, a lower quality of life, and even, concerningly, developmental delays.
That's the kicker.
Which leaves us with this thought to kind of mull over, drawn from the source material. Given this finding that long COVID symptoms in infants and preschoolers are not only distinct, but are specifically linked to impacts on their development and quality of life, what does knowing this actually imply? What does it suggest for how we might best think about supporting the long-term health, the developmental path, the overall well-being of these very young children who experience these kinds of persistent issues after COVID?